All right, everyone, I'm going to record this video to review the EKG lab. So if we pull up the lab assignment, which hopefully you see on your screen now, we can see the directions and the big review points. Okay, so we'll just start with the first point, and I'm going to go ahead and switch over to PowerPoint as well. See if I can do this. Boom, there we go. Not really concerned about these first few slides for you all for this particular class, but we should pause on the different components of the ECG. So within one cardiac cycle, we have the major waves, which I want you to be able to pick out potentially and know what they represent. So the P wave is atrial depolarization, the QRS complex, which is here, that is ventricular depolarization, and then the T wave is ventricular repolarization. The atrial repolarization is hidden by the QRS complex. Okay. Then the different intervals, which are useful to know. The PRI, which is from here to the R, that represents the entire time that blood is moving from the atria to the ventricles. What is not listed here is the PR segment, which is this segment right here. That one is represents the AV nodal delay. So blood passively is moving from the atria to the ventricles prior to ventricular contraction. And then over here, the ST segment, this is the segment that is useful for the diagnosis of cardiovascular disease, but also represents, again, that passive blood flow of blood out of the ventricles after contraction before the relaxation phase occurs. The segments should be visible during resting and low to moderate intensity exercise, but as exercise intensity is increasing and the heart rate is accelerating, the segments will often disappear, which can make an EKG harder to interpret at that point. All right, let's move ahead, and these, what I just explained to you, can be described on these next several slides as well, so be sure to take a look at these. Now, the first bullet point on the lab was to know the difference between a single and a 12-lead EKG. So these slides will show us this. A single lead is going to give us one view of the heart, okay? At least that's the way it's supposed to work. The number single refers to the single view, as on this slide, the number 12 refers to 12 views. That is not, the number does not refer to the number of electrodes, okay? So for a single lead ECG, we should be able to view that from placing anywhere from 3 to 5 electrodes on the chest of the limbs. In our lab, that did not necessarily play out because I think our device was a little bit differently. So, the device you're using could make it easier or harder to actually get a single lead EKG viewed. But classically, that's kind of what we would assume. Okay, 3 to 4 electrodes placed in the appropriate location can give you a single lead view or a single view of the heart. Okay. Then, as I just mentioned, a 12 lead is going to be generated from 10 electrodes. So we see in this diagram, we have the 4 limb electrodes, and then we have our 6 chest electrodes here. 10 electrodes would give us 12 different views, and that would give us then the 12 lead ECG. Okay. The specific leads are named as we see here. So the 6 limb leads are lead 1, lead 2, lead 3, ABR, ABL, ABF, 6 precordial, V1, V2, V3, V4, V5, V6. Now, the electrodes are not named that. The electrodes for the limb leads are named right arm, right leg, left leg. Now for the chest leads, the electrodes and the leads have the same name. So the electrodes are also known as V1 through V6, just as the leads are named V1 through V6 as well, okay? The limb leads give you more the frontal plane view of the heart, where the chest leads give you more the transverse plane view of the heart. That's why there's a difference in the way that the ECG appears when it is being recorded. Okay, I think that is a decent enough explanation for that. So let's go ahead and move on. So here we can just see an example of the way that the pictures look different. Like I tried to describe to you all in class, when the electroactivity is moving toward the electrode that is generating the view, the waves are positive in nature, so they're upward. Okay. Negative recordings are downward. If the electroactivity is moving away from the electrode, the waves will appear downward. The best example of that one is right here. AVR is generated from the right arm electrode. So the signal is moving away from that electrode the entire time. Therefore, all of the waves are downward in nature. V1 is similar, although it's kind of half up and half down because V1 is here, right? So part of the signal is going towards it, part is going away from it. V2 is similar. Pretty much the rest of these then, the electroactivity is moving toward the electrode, so they're all going to be positive deflections or positive waves, upward facing waves. All right, so this is something to review for the quiz for sure, is the placement of the electrodes. So, can you place these in the appropriate location on myself or one of the TAs? I would expect you to be able to verbalize where they go. You would then want to palpate it. You can't just say it and pop it somewhere without palpation, because without palpation, you cannot properly place it. So be sure you can verbalize where they go, palpate it, and then obviously place them in the appropriate location. For the quiz, we would probably be working with the stickers. So you would be palpating directly, over our clothing in the appropriate location and placing stickers in the appropriate location. But again, you should be able to verbalize it, just as it says here, but then also palpate it as well. Okay, so spend some time reviewing this or practicing it. All right. I'm not going to ask you about the calculation of heart rate on the lab, but we did review this, and as part of the lab assignment, you did have to determine heart rate using both methods. So if you have any questions about that, just ask me and I can explain it to you in person in class, okay? All right, so the rhythm is the other big thing for the quiz. In order to determine the rhythm, what it's called, there's two big things we need to know. A, what the rate is, so what the heart rate is. B, do the waves look normal? Okay, so knowing what normal looks like is important. That is why it's good to go back to like all of these slides back here, especially, not that one. Where is that? Oh, this one, yeah. This is kind of the classic normal looking EKG, especially for lead 2, which is the one we usually use if it's a single lead EKG, okay? Small rounded P wave, nice tight QRS complex. T wave that is larger than the P wave in all likelihood, also is rounded. Size would be between the P wave and the QRS. Okay, that's normal. And then if it's resting, we should have some visible segments. If it is during exercise and the rate is accelerating, the segments would disappear or shrink for sure, at least. Okay, so with that in mind, let's go back to here. Okay, so really like the three big normal rhythms are normal sinus. So if the rate is between 60 to 100 and the waves all appear normal, that's normal sinus rhythm. Okay. If the rate is less than 60, and again the waves look normal, then that is called sinus bradycardia. That could be due to being very fit. It could be because you're laying on your back or asleep, or it could be pathological as well. You would kind of need to determine the situation and who the person is, what you're looking at, okay, to determine if it's normal or not. The other one that is typical is the sinus tachycardia. So if the heart rate is above 100 beats per minute and the waves look normal, then we call that sinus tachycardia, okay? That could be, that's going to occur during exercise, obviously. That could also occur due to stress, a lot of caffeine intake, any kind of stimulant. May also be pathological as well. So again, you want to kind of gather information about the subject and know what the situation is before determining if this is okay that they're in sinus tachycardia or is it due to an abnormality, okay? Notice the difference if I jump back here. The cycles are very spread out. The segments are very visible, but once we get to sinus tachycardia, The cycles are much more compressed because the heart is beating faster. The segments have essentially disappeared, and there's very little downtime between cardiac cycles as well. We're back over on this one. There's a lot of time between cycles because the heart rate is so low, right? So just, be familiar with those three. Like if I describe a situation to you, I give you a heart rate and I tell you the waves look normal, you should be able to tell me is it's normal sinus rhythm, sinus bradycardia, or sinus tachycardia, okay? Now, on the lab, I have it written here to understand common athletic arrhythmias. Again, that is something that I'm going to leave to the EKG class with Dr. Dials. So I do have some examples of slides here. So you review these. I'm not going to ask you about these on the quiz. But these do just show us some of the common, obviously most athletes, they're in very good shape. They're going to have sinus bradycardia, right? Which is, in this case, not an abnormality. Necessarily up to 80% will have that, okay? Moving on down, another common one is the hypertrophic cardiomyopathy. So about 1/3 of all fatalities in athletes are due to this heart condition. At least in the past, I'm not so sure if that's going to be the case moving forward. But when I was a kid, you randomly hear about basketball players, football players dying of this condition on the court. Reggie Lewis was a famous player for the Boston Celtics, really good. Dropped down on the court one day, and he was determined to have this condition. Okay, how does that appear on the EKG? This picture is not great. Again, I would ask Dr. Dials about that one if you haven't talked about it already. Okay. Then as far as the protocol goes, I might ask you to describe the Bruce treadmill protocol. So just be familiar with this. It is shown here. 3-minute stages. The grade changes by 2% every stage, but we started at 10%. And then there are specific walking speeds that are designated for each stage. And then, what is the purpose of this? Is more of a diagnostic exercise test protocol versus a performance-based test protocol, which the A-strand running protocol would be. Okay. So I think that about covers everything we need to say for the EKG lab in terms of preparing you for the quiz upcoming. If you have any questions about the lab or anything else, please let me know. Otherwise, I will talk to you all next time. Goodbye.